Coming up, we will be on location at the Maryland Spine Institute in Bel Air, Maryland, discussing advances in pain treatment and physical therapy and how they can help you relieve pain and regain the quality of your life with one of this region's top natural pain relief doctors, Dr. Herold. Dr. Herold is the clinical director of the Maryland Spine Institute and received his Doctor of Chiropractic from Life University in Atlanta, Georgia. Dr. Herold is a member of the Maryland Chiropractic Association, among other organizations, and again is widely recognized as one of this region's top natural pain relief doctors. Welcome, Dr. Herold. It's a pleasure having you on our program. This is your first time, in fact, on the Top Doctors Medical Interviews.
Yes, Rocco, it is, yes.
We've got a lot to talk about. We've got several patients that are going to be joining us a bit later in the program. We're going to see you demonstrate or perform some treatments as well, I believe, on some patients. But I wanted to begin, if I may, Dr. Herold, by asking you if you can please tell us about what some of these latest advances are in pain treatment and in physical therapy that can help so many folks out there.
Okay, thanks, Rocco. You know what, sometimes it's real hard to start at one place. There's been so many advances over the past 15 to even 20 years with just natural pain relief that a lot of patients out there, they just don't know about it. For one, there's chiropractic, where many people in the past, they feel like it's going to be something real strong or real aggressive, but now lighter treatments are actually more effective. Things like the activator, things like soft touch and myofascial release. So there's physical therapy, focusing more on core exercises and strength. There is new advances in custom foot orthotics. Custom foot orthotics are basically where we're able to level out how people are standing and reduce the pressure in the lower back. There are also many pain relief products that we have here. Patients can take either at home, or there's even something called a lumbosacral orthotic. Basically, we call it short as an LSO. And what that does is that it basically supports the lower back, and it helps to reduce the pressure and reduce the pain in the lower back.
Very interesting. So there's quite a few advances that have taken place over these years, and you just touched on some major ones.
Yes.
That can help so many folks out there. And I think what you said there a few moments back is very important, Dr. Herold, and that is these are the types of treatments one should be aware of and look into before they consider surgery, because so many folks out there, you know, think they have no other option but surgery. They don't realize that surgery really should be the last resort.
Yes, Rocco, you're very right. Here at the Maryland Spine Institute, we're very conservative practice, and what that means is that it's not that we never refer anybody for surgery, but it's always the last option.
Yeah.
So we're going to exhaust everything within our means and within our power. We're going to use any and every of the latest treatment that's available to make sure that we know that we've exhausted all possibilities before we recommend them to some of the top surgeons that we work with in the area.
Yes, indeed, and we hear so much about decompression, for example, as a very effective treatment to relieve, if not eliminate, back pain. Can you please tell us a little bit about that?
Yes, we've been getting remarkable results with many different patients. Decompression, basically, it's a machine that we use to really help open up the disc space, allow for better motion, better blood flow, better oxygen to flow into the disc. Once that happens, the body's able to repair itself, and the body's able to create a better blood flow in and outside of the disc.
Which really helps not only eliminate that pain, but basically brings us back to what we were before the pain got into those areas.
Exactly, exactly.
Now, I also understand the cold laser treatment is another highly effective option for folks. Can you please tell us a little bit about that?
Yes, cold laser therapy is actually an application of red and near infrared light, and what that does is that it's applied to the soft tissue injury, whether it's the shoulder, whether it's the knee, whether it's the elbow. Sometimes it could even be applied to the spine. And what that does is that it really promotes soft tissue healing. And what I like to tell patients, it speeds up your recovery time.
Very interesting. In other words, another non-invasive treatment, but one that's highly effective in eliminating that pain in those soft tissue areas.
Exactly. Every treatment that we perform here, Rocco, is pretty much non-invasive.
That's certainly good to know, Dr. Herold. can you elaborate a little bit more for the folks out there that are watching regarding how the decompression and cold laser treatments work as far as what they'd be looking at going through?
Okay, well, first of all, Rocco, our number one goal with every patient is to reduce the symptoms, reduce pain. So that's what actually both of them do. They really help to reduce pain, and here's how. They do that by reducing the inflammation that's localized in the area. Many people, whether it's in the disc or whether it's on a shoulder and a rotator cuff, there's a lot of scar tissue that develops because many people, they wait months, sometimes even years to do anything about their problem. And what happens is that that scar tissue develops, and that scar tissue, it's almost like a scar on my hand. What we have to do is help reduce the scar tissue by reducing inflammation, increasing blood flow to the region, reducing the muscle spasm that's also localized in the region, and also all of those coupled together, along with the other treatments that we perform here as well, helps to reduce the pain.
Well, that's certainly very interesting, Dr. Herold. I appreciate you elaborating a bit for us. And I understand another benefit from these very effective treatments that you've educated us about thus far is that in addition to pain relief, elimination of the pain, we also can get better balance as far as our whole body goes from some of these treatments, right?
Yes, there are the chiropractic treatments that basically work to correct the alignment of a patient that could have been there for years. And basically what we do is we work to improve posture. We work to improve the pre and post x-rays that we do take with patients. There are the lumbosacral orthotics, which also helps to bring more balance to the pelvic region. And then also there's the custom foot orthotics. The custom foot orthotics does two things. It helps to level out how somebody's standing over time, to reduce the abnormal shoe wear and to reduce the pain probably even with foot problems. Let's say plantar fasciitis, foot heel spurs, foot pain, knee pain as well.
Well, there's a lot of people that suffer from those problems as
Exactly.
well. Now, what would you say are some of the advantages of these non-invasive but effective treatments as opposed to some of the more traditional methods that are out there?
There are a number of advantages. For one, we're very non-invasive. So what I'd like to tell a lot of patients, we're not putting anything harmful in, and we're not taking anything that God gave you out. We're working with the body that God gave you. And what we're doing is we're working to really help reduce your pain, reduce your inflammation, and get the patient to a better quality of life.
Well, that's certainly some powerful benefits right there. Now, how do you diagnose patients for treatments? What do you all utilize here from when a patient comes in to find out, diagnose what's the best treatment option for each individual?
How we diagnose the patients is actually a great question because we actually use a very extensive program to make sure that we find the root cause of what's going on, which is really not done in healthcare today. So first of all, we have on-site x-rays. We perform physical therapy examinations, chiropractic examinations, postural examinations. We take all vital signs. We also do something called surface EMG, where basically we're measuring the balance of the nerves within the spine. And also there's a bilateral foot scale that we also do to see if somebody is putting more weight and pressure on one side of the body compared to the other. Speaking about more of the latest advances with diagnostic testing, we also perform on-site nerve conduction velocity test. This is where we are able to test the strength and the speed of the nerves traveling through the body. This allows us to pinpoint exactly where the problem is, whether it's a neck problem, a shoulder problem, an elbow, or anywhere in the extremities.
So in other words, based on what you just told us, Dr. Herold, you all utilize a very thorough and precise diagnostic process here to not only specifically identify the problem, which then I would take it results in knowing which effective treatment to offer as a solution to the patient to eliminate the problem.
Exactly.
We're now going to meet several patients of the Maryland Spine Institute. Welcome, Rocky. It's a pleasure having you on our program.
Thank you. It's a pleasure to be here.
I love your nickname. It's the same as mine.
Really?
Now, I wanted to begin, Rocky, by asking you if you can please tell us what problem or problems you might have been experiencing prior to coming to the Maryland Spine Institute.
What I did was I injured my back one day, and it became quite severe. So I opted to come to the Maryland Spine Institute because I did not want to face a surgical procedure. The pain radiated down my leg, and it made it almost impossible for me to really function. So I chose to come and see what kind of help I could get here.
My goodness, so it's really affecting your life, your daily life.
Oh yes,
the
I
pain was
couldn't.
going down your leg, and you said you had a hard time.
Yes, I couldn't touch my knees.
My goodness.
And bending over was impossible.
So then you came here, and what took place?
Well, after my interview here, then of course there were X-rays to determine exactly where the damage was. It was in my lower back. And then the processes that were recommended was decompression, followed by a bunch of periodic manipulations and adjustments to see whether or not it was going to get better.
Sure.
Which it eventually did. It was a long procedure.
So how long over a period of time was it? Did you have to come back on follow-ups? Was it over a few weeks, a few months?
No, it was months.
It was?
Yes.
So
yes.
you were coming on a regular basis?
Yes.
And then what happened?
Well, eventually I got to a point of where the pain level began to decrease. And at that time I said, okay, I'm feeling a little bit better. And they said, well, we want now to expand the number of exercises, therapeutic exercises that we're giving. And so I began doing that, and little by little, the pain relinquished more of a grip on me, which was fine, and I could actually begin to do some things.
Excellent. So you started getting your life back, in other words.
Yes.
You were able to bend over now,
Yes.
I take it?
Yes.
Bend down?
Oh, yes.
Great, great. And as far as the viewers out there that are watching Rocky, what would you tell them about your experience with not only the doctors here, but the staff and the folks at Maryland Spine Institute?
It's an interesting question because the Dr. Seymour was the first one that I met. And previous, it was after that, it was Dr. Herold. But they were most aware and conscientious about what treatments were that I needed. And the staff here is just absolutely phenomenal. They welcome you, and they watch you very carefully. So I was very happy.
Well, on that note, I'd like to thank you, Rocky, for coming down and sharing some of your experiences with us and being a guest on our program.
Thank you. It was my pleasure.
It's our pleasure. Welcome, Elizabeth. It's nice to have you on our program as well.
Thank you. It's nice to be here.
Now, I wanted to begin by asking you, basically, what brought you here to the Maryland Spine Institute? Were you experiencing some discomfort, some pain?
Yes, I was having some upper back pain and neck pain, and my husband had started coming here first. He was having good results, so I started coming here as well.
Oh, so your husband was going through some problems before he came here.
Yes.
He got good results, and then you followed.
Exactly.
All right, and can you tell us a little bit about what happened once you got here as far as from the diagnosis to the treatments?
Yes, I started with having an evaluation with some x-rays,
Okay.
and Dr. Herold found that my cervical spine and my neck was very straight where there should be a nice curve to it. So he started doing a series of adjustments and prescribed therapeutic exercises, which I did several times per week,
Okay.
along with some electrical stimulation and something called a posture pump when I was here.
Oh, and over how long of a period of time did this take place?
Several months.
Okay. And did you feel some relief over that time?
Absolutely.
And was it something that took a month or two in, or did you start noticing it sooner?
As soon as I started having regular adjustments, I started having a lot more relief of my pain.
Great. That's wonderful to hear
Mhm.
that. So how do you feel today?
I feel very, very well today.
Excellent. And for the folks out there watching, what would you tell them about Maryland Spine Institute?
It's a great facility. Dr. Herold is great, and the staff is very, very friendly and very accommodating to schedule changes and things like that. They're always very welcoming.
Well, on that note, I'd like to thank you for coming down and sharing some of your experiences as well. Thank
Thank
you,
you.
Elizabeth. Hi, Luke. It's nice to have you on our program.
Thank you for having me.
I wanted to ask you, Luke, what pain or discomfort were you experiencing that brought you here?
I had severe migraine headaches about 3 to 4 times a week, and every day that I didn't have a migraine, I had a very bad headache. So a few years ago we saw an ad in the newspaper for a like, I guess, consultation, and they said come by and have a just let us check your neck and things like that, and then they decided that I should get an MRI, and from there on we did therapeutic exercises and got my back adjusted and electrical stimulation for my back, and after about 2 weeks my migraines were completely gone and I could resume doing things in my life, because previous to coming here I was pretty much crippled most of the time in my life.
Oh my goodness, that must have been extremely difficult for you before.
Yeah, it really lacked what I could do in my life.
Yeah, because especially migraines, Luke. That we all know from experience how painful they can be and how much they can affect one's life, especially a young man like yourself who's probably very active.
I had sports, and between sports and school, it was bad. I couldn't do school. I had missed a lot of my sports. Couldn't hang out with friends.
Well, now all that is, you can do all those things again, right?
Yes,
You got your life back, Luke.
I have completely got my life back. I hardly ever get any migraines or headaches, and I've actually only had one migraine since probably about 2011, and
That's great. You're talking over a couple of years.
yeah, it was every day. I was vomiting, and just it was very bad, and now all my symptoms are pretty much gone.
That's wonderful. We're so happy to hear that. And you still come back occasionally?
I am on a maintenance plan, so I come once a month just to get my back adjusted, and yeah.
Keep everything the way it is that way. And on that note, as far as the folks out there watching, what would you tell them as far as your experience goes with the staff here as well as the doctors?
The staff is great. They everyone knows your name. They're very kind. They're very accommodating to anything that might come up in your schedule. If you need to reschedule an appointment, the doctors are wonderful and they're very knowledgeable. It's just a really great business.
Well, on that note, I'd like to thank you, Luke, as well. We
Thank you.
appreciate it. Welcome, Patrick. It's nice having you on today.
Thank you. How are you today?
Fine, thanks. We're looking forward to interviewing you and getting your perspective on what you went through and how you feel today. And on that note, I'd like to begin, Patrick, if I may, by asking you if you can please tell us what pain and discomfort were you experiencing that brought you here to the folks at Maryland Spine Institute?
Well, I had two different issues that I've been dealing with. One of them for about 20 years was lower back pain. I had found through an MRI that I had arthritis on my spine, compressed discs, bulging discs, sciatica, all those common things that people are going through. And I was at the point where I was ready for surgery and didn't know what else to do, and figured I'm going to try another place and a different opinion and see what they say. And that's the first thing I said when I came in here was, if you tell me I need surgery, I'll do it.
So basically, after you'd already met with some other folks, other medical professionals out there, and you had heard surgery on multiple occasions, and you figured, let me get one more opinion. You came here to the Maryland Spine Institute, and it looked like you made the right decision because they told you here that you wouldn't need surgery.
They said we have some things that we can try that you've never done before, and I was open to new ideas and something different, and when they suggested what they wanted to do, I was all in. I jumped in with both feet and did everything I needed to do, and was successful because of that.
Well, that's wonderful. Surgery should always be the last resort, so it's always good to get extra opinions, and in this case, it obviously worked out for you. So they obviously put you through treatments, Patrick. Can you tell us a little about what they did to you?
Sure. Decompression was a very good benefit to me. I love the decompression table and the benefits I get from that. Of course, spinal manipulation and the chiropractic adjustments, but also talking with the staff and the doctors, we came up with some exercises that specifically targeted the areas that I needed help with to strengthen those muscles there, relieve some pressures and tensions that we needed to get rid of. And through doing that, I found certain exercises that I've never done before that I can do right now. If I'm starting to get a little bit of tension build up, a little bit of nagging pain in there, I can relieve them at home without having to come back to the doctor.
Well, that's wonderful. So they customized some treatment solutions for you. in addition to some of the other treatments like decompression, like you said, and spinal manipulation. And you, obviously the pain is gone, I take it?
Yeah, it went from my back telling me what I was going to do that day to me being able to tell my back what I was going to do that day.
You're back in control.
Yeah,
You've
yeah.
got your life back.
I got a young boy. I'm the coach of the baseball team, and I need to be out there with the kids playing, and I can do that now.
That's right. Now, that's so wonderful to hear. You've got all aspects of your life back. You can do the things that you might not have been able to do before when you were going through all that pain.
Another issue too, I said there was two problems that I'd come here with. The other one was with my throwing shoulder. Injuries to that through the past and my occupation and things that I've done in the past had wore the shoulder down, and we weren't sure where we had to go, and finally decided I had to do surgery on my shoulder. But what we did was I came here for pre-surgery physical therapy to help strengthen the muscles that are around my shoulder, so when I was recuperating from surgery it would go quicker and easier and faster. So I was here before surgery, and then after surgery there's a whole prescribed list of things to do and how to do them to recover, and my goal was opening day for baseball season to be able to throw a ball and pitch to the kids, and it's opening day and I've been pitching for 2 weeks now, batting practice.
Wonderful. Congratulations.
Thank you.
That's a big step right there,
Absolutely.
considering what you were going through regarding that shoulder a little while back.
You know, you walk out of surgery and you can't even move your arm, and you wonder, oh, this is a long road to go, and now it's 6 months ago, and I'm perfectly fine.
Well, that's wonderful. And Patrick, lastly, before I let you go, for the folks out there watching, what would you tell them about your experience with the staff here as well?
The staff is great and friendly. You can tell that they really enjoy working with each other as well as working with the patients. And this is the one doctor and the doctor's visit that I look forward to versus, not wanting to come to.
Yes. Well, on that note, I'd like to thank you. We always appreciate it when patients take time in their busy lives to come down and share some of their experiences with us. So thanks again, Patrick.
Thank you.
Hello, Minnie. It's nice having you on.
Thank you for having me.
It's our pleasure, young lady. I wanted to begin, Minnie, by asking you, can you please tell us briefly what difficulties, pain you may have been experiencing that brought you here?
Okay, I had a sciatic pinched nerve, which was very painful. I've had shots in my back twice, 2 years in a row, and I had surgery on my back. It was recommended that I come to the Maryland Spine Institute, which I did, and I wish I had done that before I had the surgery. Anyway, Dr. Herold took x-rays of my back and my neck was, the curve was out, and I had bad discs in my back. So I did the decompression, and I did the electrodes and the ice on the back and the adjustment and exercises.
So you went through all these treatments.
Oh, I went through all of this, yes.
And in hindsight, like you just touched on a few moments ago, if you had known about the Maryland Spine Institute, you may have been able to avoid the surgery
Yes.
that you had previously.
And I could have avoided the shots in the back too.
Yes, but better late than never.
True.
So how do you feel now?
Much, much better.
Wonderful. And how often are you still coming back here?
I'm coming back once a week now.
Okay, just to keep the maintenance going.
Just to keep the maintenance going.
Wonderful. And how long is each of your visits on average?
On average, I started out 4 days a week, and then I went to 2 days a week, and now I'm down to 1.
And it's about, what, a half hour, 20
Probably
minutes?
about 45 minutes by the time I get adjusted and the therapy and the
Sure.
exercises.
Well worth it, though,
Yes,
right?
it is. It really is.
Well, and lastly, as far as the folks out there watching,
Oh, they're fantastic. The girls watch you, make sure you do everything properly. If you're not, they come over and show you how to do it and straighten you out.
that's wonderful, Minnie. And on that note, I'd like to thank you for joining us and being a guest in our program.
Thank you.
It's our pleasure. Welcome, Ronnie. It's nice having you on.
Thank you.
I just wanted to ask you the same question I asked the other patients, Ronnie, and that is, what brought you here?
Terrible pain in my shoulders and neck.
Oh, my goodness.
Couldn't move.
And obviously that was affecting your day-to-day life.
Oh yes, couldn't even put a coat on without being in pain.
And how long were you experiencing all that?
About a month and a half.
Was it just getting progressively worse?
Yes, it was.
My goodness. So then what happened?
Well, I had been here before, so I knew I needed to come here. It was just a matter of doing it.
Yes.
And I came and saw Dr. Herold, and within, a week, I was feeling better. I was able to put a coat on without having terrible pain.
Oh my goodness. So what did you have done?
I had adjustments, and I had some stimulation with ice, and of course physical therapy, which helped as well.
And did you come a few times within that first week?
First week I came 4 days.
Okay, and that's when you started feeling better. Like
Mhm.
you could actually put a coat back on.
I could
for
put a
God's
coat
sake.
back on without grimacing in pain.
Oh my God, that's a big step right
Mhm.
there. And then what happened after that?
I kept coming, and I came probably 4 days a week for the next 2-3 weeks, and then I progressed to 3 days a week, 2 days a week, and now I come once a week.
Just to keep making sure
Mm-hmm.
that that pain doesn't come
Mhm.
back and
That's
you can
right.
still enjoy your life.
Yes.
Well, that's wonderful. And lastly, before I let you go, what would you tell the folks about the staff as well?
Staff is wonderful. They are very professional, they're accommodating, and very pleasant, and they really, while you're here, they make sure you have a good time.
Oh, that's wonderful. And on that note, Ronnie, I'd like to thank you as well for joining us and being a guest.
Thank you.
It's our pleasure. Welcome, DELAINE.
Thank you.
I wanted to ask you, DELAINE, what were you experiencing regarding pain, discomfort in your life that brought you here to the Maryland Spine Institute?
I had a severe case of sciatica to the point where I couldn't lie down, I couldn't walk, I couldn't stand. It was excruciating pain. And I had been to a spine surgeon who recommended surgery. In fact, he wanted to do it as soon as possible.
Of course he did. That's exactly what a lot of them, unfortunately, recommend, rather than looking at other treatments, because surgery should always be the last resort, as I mentioned earlier.
That's right.
So then you came here to the Maryland Spine Institute?
Yes, I
and
did.
You met with the doctors?
Yes, I did.
With both Dr. Herold and Dr. Seymour, or one of them?
I met with Dr. Seymour at
Okay.
first. Yes.
So then what happened?
They recommended, after x-rays, they recommended a decompression and then therapy afterwards. I did the decompression, and that was about 4 times a week. It's been about a year now. I'm down to 1 day a week maintenance, but it's been such a difference. I mean, I can even do yard work now where I could hardly walk.
DELAINE, that's wonderful. That's
Yes.
great to hear. You can do everything like you were able to do before all that pain came.
That's right.
That's great. And so you're down to once a week now just for maintenance?
Yes, that's correct.
And how long approximately is your visit here each week?
It's about 45 minutes.
Okay,
Yes.
okay, just like with some of the other patients.
Yes.
That's great. And for the folks out there, what would you tell them about not only the doctors, but your experience with the staff here as well?
I think the staff here is very caring. They're very professional. To me, they're more like family as opposed to just professionals.
That's wonderful. And on that note, I'd like to thank you, DELAINE, for joining us and being a guest.
Thank you very much.
It was our pleasure. One of them, their life changed. They were suffering in various parts of their body, in excruciating pain in some cases. Prior to coming here, their life was turned upside down. Basic day-to-day things they were unable to do in
Yes.
some cases, and they came here, and now they are back to who they were. They regained their lives, and they're living normal lives again. And you could just see that, and I just wanted to let you know that it's very impressive work indeed.
Thank you, Rocco.
Is it possible, doctor, to track the improvement of a patient, not only after the treatments to eliminate the pain, but ongoing as far as from the diagnostic technology that you have, the treatments that you have for the future as well, to know if this is something that can either come back or whatever the case may be with each patient?
Exactly. What we do here is, unlike any other facility, we really try to monitor subjective results as well as objective results. And what that means is basically not just how the patient feels, but how we're observing them as a team. Does the massage therapist note that there's less muscle spasm? Or do the physical therapy aides, do they notice that the patients can perform their exercises with less pain and also increased range of motion? But what we also do, which is an added measure to what we do here as a team, is we perform pre and post x-rays as the patient continues to come to the Maryland Spine Institute. And what the pre and post x-rays allows us to do is see what long-term changes are actually taking effect when the patients are performing exercises and going through their normal regimen.
Now, are these results permanent that the patients have experienced that we interviewed, not to mention the many others that come to your practice?
That's actually a very good question, Rocco. I'd like to tell every patient that walks through the door, no result is going to be permanent unless you learn how to manage the condition that you have. Because the pain will always come and go, but the problem is what we are trying and aiming to solve with every patient. So the results that we have here, many patients will tell you that it's longer lasting. Why? Because we're looking for those pre and post x-ray changes, and we're making sure that their postural muscles are taking effect and also learning how to support a better posture within the body.
That's certainly very impressive, and it's good to know that. Now, we're literally out of time, Dr. Herold, but you and your practice, the Maryland Spine Institute here in Bel Air, Maryland, have certainly established a reputation for excellence, not only in pain management, chiropractic care, and physical therapy, but also in patient care. And I just wanted to ask you, what would you say really helps separate you and your practice apart from many of the others in this region?
In all honesty, Rocco, I think the first thing that we do that really sets us apart is that we truly take the time to find out what's wrong with patients. There are many patients on the first day, they feel like nobody's listened to them until they came here. So we truly take the time to find out what's wrong with the patient, what's the root cause of the pain, and to see if we're able to help them with anything that we have here. If we're not able to help them, we'll definitely point them into the right direction, whether it's a surgeon, whether it's a neurologist, whether it's another facility besides here. So the next thing that we do that really that truly sets us apart is that we have an amazing staff. The staff here are very knowledgeable, they care, and they take the time to make sure that patients are well thought of in their treatment plan.
Yes, indeed, and we heard as much from the patients we interviewed here. We interviewed several of them where they basically stated that not only does the staff, in addition to you and Dr. Seymour, really take care of them and give them that individualized attention, but also treat them like family in many cases.
Yes.
And you can't say that about everybody out there these days.
Yes, that's so true. We go through a rigorous process with just training a new staff member and just making sure that they're up to date on all of the latest technology and all of the latest advances with physical therapy, chiropractic, and diagnostic. But to sum it all up, Rocco, what means the most to me as a doctor is seeing a patient have a better quality of life, seeing patients be able to walk through the mall with their spouse, being able to play a game of baseball or football with their son, to be able to go out and hang out with their family and not have so much pain, and to not be addicted to many of the strenuous and harmful drugs that they typically used to take before they came here to relieve their pain.
Yes, indeed, and as we said at the start of this interview, and I think it's very important to mention to all the folks out there as well, Dr. Herold, that surgery should always, regardless of what type of body part we're talking about or whatever may be involved, surgery should always be the last resort. And to know that there's places like yourself here that can help people with non-invasive and highly effective treatments to eliminate pain in various parts of our body without developing a potential addiction to drugs, as you just said, painkillers, for example, I think is very, very good for all of us to know that people like you exist that can help us like that.
Yes, Rocco, and that's very true. And I think the last thing that I would probably stress to many patients or anybody that's watching is basically do something about their problem now. We're able to help, I would say roughly about 80% of our patients, they tend to get better with the regimen here. But usually there's a good 20%, Rocco, unfortunately, that we can't help. And I think the main reason why we can't help them is because they waited too long to take care of their problem. So if there's anybody out there that has any type of pain that's maybe coming and going, that's evidence that there's an underlying problem that's not going away. The pain will come and go, but the problem is what we tend to deal with all of our patients. And if we can solve that problem as a team, we'll help them get a better quality of life, and that's what it's all about.
Yes, indeed. You don't provide Band-Aids here. You actually eliminate the cause of the problem.
Yes, indeed.
So we can experience these results for the rest of our lives. And on that note, I'd like to thank you, Dr. Herold, for educating us, enlightening us, and being a guest in our program.
Thank you so much, Rocco.
It was our pleasure. Thank you.
God bless you.
God bless.